You've seen us use it on the face, but this is a new application.
These results you need to see to believe. Unlock your fountain of youth today on The Doctors. We're changing every body, one body at a time.
A laser. I'd like to first show you what it looks like on this piece of paper. It has this grid-like pattern. So it's actually treating you in these fine little micro dots.
My elbows definitely age me. You know, the Shar-Pei dogs where they have the puffy little cheeks and the wrinkles and all the folds, that's exactly what my elbows look like. People always think that I'm either mad or that I'm cold because I always have my arms crossed. But I'm not. If I keep my arms crossed, it smooths out my elbows. I've tried everything, firming creams, anti-wrinkle creams, tightening creams, scrubs. So far, nothing. I really wish I could have my smooth elbows that I had when I was younger.
That was Jackie, who hates how the wrinkles on her elbows make her look older. So Jackie's here today backstage in our procedure room with Dr. Orden and dermatologist and cosmetic surgeon Dr. Sandra Lee to show us a new way to get rid of those elbow wrinkles.
That's right, Travis. And you know, in Jackie's case, she really doesn't have a lot of wrinkles anywhere else, right? Right, Dr. Lee? And she looks so good that I know it may sound a little silly when she's wearing short sleeve blouses, dresses, things like that. Those wrinkles on her elbows show, and we see that. These are exposed areas subjected to sun and lots of movement. It's that movement that causes laxity and wrinkles. Just like other parts of the body, we get the same thing on the knees as well.
Yeah, we don't think about it because it's behind us, but sometimes when you catch a shot of it in the mirror, you go, oh my gosh.
And, you know, we're all going to get these wrinkles, but in a case like Jackie's, if they stick out a little bit more in relationship to the rest of her things, then maybe we can do something. And in this case, Dr. Lee has a treatment.
Yes, we do. We have a two-part treatment today. It's actually really, it has wonderful results. First, we're going to use a filler to put volume back in the elbow and make it less saggy. And then we're going to use a laser to tighten the skin on the surface and remove some of the fine wrinkles and improve the texture.
So two stages, just like we would do for facial laxity and lines.
Absolutely.
Do some filling, do some resurfacing. Let's get going.
Okay,
so stage
let's do
one.
it.
Now, in this case, this filler, you've mixed with a little bit of
Novocaine,
you can see,
lidocaine.
So
you can see a little bit coming out of this. It's a whitish kind of
little
filler,
little pasty.
and I'm just little paste exactly. It's actually the same thing as what you see in bone or in your teeth. It's the same component, so very safe to use, and it really fills in that area.
And you can mold that a little bit. And I say in this case, Dr. Lee is definitely doing what I would call a deeper injection. She's not trying to fill the lines per se. She's trying to put volume underneath to plump it. She's going to get those fine lines with the fractional CO2, correct?
Yes, yes, exactly. So see the fine lines here we're going to get with the laser, but in this case we're going to inject underneath here to just raise that area and give it a little more fullness back like when you were a teenager.
Okay.
So that's a nice thing. And this is really great because this can last for over a year. It's really nice, and it's really not very painful. I think it's minimally painful because there's numbing in here. Okay, so now we can actually move over to the laser because we got most of this filler in here.
Okay, I can see that. You've plumped that up pretty nicely. So you're going to fire up this fractional CO2 laser. You've seen us use it on the face, but this is a new application. Goggles on because this is a laser.
Here we go. And actually, I'd like to first show you what it looks like on this piece of paper. It's really, really cool because it has this grid-like pattern. So it's actually treating you in these fine little micro dots, like the period at the end of a sentence.
And that's the key, that there's little areas in that are being spared of this thermal injury. What does that translate to? Quicker healing, less redness, less potential for scarring.
Right. The traditional way to use this laser is we'd have to put people under general anesthesia, and in this case we don't, which is so nice because it would take 10 minutes to do this. I mean, it takes a half an hour to do it with the face, which is where it is most commonly used. And it's such a versatile laser. I really love this laser because you can do so many things with it. You can treat scars, deep acne scars or surgical scars on the face. You can treat pigmentation, just if people have problems with brown spots, and you can also treat lines and wrinkles, and it does such a good job with it.
Well, you can see those lines contract right before your eyes.
There we go.
You're not going to see that final result, but you can see that between the volume that you've added and the resurfacing of those lines, that appears better.
I mean, we've treated her arm with the laser rather delicately. It's a Mixto laser, but because you can't be very aggressive on the arms, they have a tendency to scar more easily.
So let's take a look at Jackie's before picture again. All right. That's a pretty similar pose. So we know she's swollen, but big improvement.
That's going to go down, and really we take multiple treatments with the Mixto laser, but she's going to have fantastic results in really a couple weeks. 1 week.
Very nice. Jackie, thank you. Dr. Lee, thank you as well.
Thank you.